Dementia care can differ greatly depending on where you live in a country and where in the world you're from. But researchers at Newcastle University are trying to change this by looking at new ways of living better with dementia, no matter where you call home. We sent Jonathan Gibson to Newcastle in the UK to find out more.
This centre in Newcastle is a specialist facility where people living with dementia can enjoy a range of activities in a safe and secure environment. As more of us live for longer, rises in life expectancy increase the risk of developing dementia. At the Newcastle University Institute for Ageing, research is taking place into the best ways of supporting people with dementia and their families.
It very much involves looking at, if you like, what aspects of care can be undertaken by the GP and or specialist nurses and community services, and usually developing what we call a shared care pathway so that people are clear who undertakes what, and also community resources know exactly when to contact the specialists for help.
This holistic approach to care is already widely used to manage other chronic conditions, including cancer and diabetes. By contrast, dementia care in the UK currently is a bit of a postcode lottery.
In reality, what that means is that the care you receive may not be determined by greatest need, but simply as a consequence of where you live.
Lorraine knows all about the challenges of identifying the best care for loved ones living with dementia. Her mum was diagnosed 2 years ago.
It's been a huge role reversal. I didn't know who to go to for help, because every time I went to somebody it was like it wasn't their department. And when you're trying to look after someone with dementia and have a family and try and work and have a balance, it becomes impossible at times.
Lorraine's experience is shared by many families who feel they're left to find out things for themselves. At Newcastle University Institute for Ageing, digital tools have been created that can support families to learn more and connect with others.
So what we've got here is one of our courses which is on staying connected and living well. And you can feel very isolated. It's often difficult to know what to do in difficult situations. But one of the most useful parts of these types of courses is that through digital platforms we can connect to other carers and they can talk about their experiences and share different strategies of what's worked for them.
Making sure families facing dementia get the right support can fundamentally change their day-to-day lives. Joe is an Admiral nurse at the Bradbury Centre in Newcastle. He's one of over 225 specialist dementia nurses that are being provided through Dementia UK.
Admiral nursing is often a lifeline to people. It requires specialist knowledge of understanding the condition, supporting families, understand the complexities that can occur in dementia, the transitions that can occur throughout the progression.
This is specialist dementia care and support in action.
She's been stimulated, she's been fed, she has something different to talk about. And to be fair, she might not want to look at my face every day. So it's good for both of us.
By supporting patients and their families to manage their own care pathway, this change in approach to dementia management through research, digital tools and specialist services is helping society prepare for the consequences of everyone living for longer.
The numbers of people with dementia are rising as our populations age. Consequently, we have a greater demand for care that's available. And a few years ago, the World Alzheimer's Organization actually suggested that the current model needs to change because demand was outstripping supply. We're very fortunate here in Newcastle because the Alzheimer's Society here in England have actually awarded us a considerable sum of money to actually research into developing such a primary care facilitated shared care model. And of course that has implications not just for the UK, but actually globally.